Joining us now, Dr. Robert Murphy is professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Well, let's start with this Delta variant and reports on its symptoms.
Yeah, it's the same virus. It's just a slightly different variant, as they call it. The symptoms apparently are a little bit different. Not only is it more transmissible, but there's more symptoms like sore throat and runny nose, and a little bit less in loss of smell and taste. So it's getting to look more and more like the other respiratory type colds and flu that normally come around. So there will be no way to distinguish based on symptoms what you have. Need to be tested right away.
Dr. Murphy, how are these vaccinations doing against the Delta variant? I understand J&J is saying that their vaccine is doing quite well against the Delta variant.
Yeah, no, the good news, and we got to have some good news, is that the vaccines look like they're working okay against Delta. Like you mentioned, what Dr. Fauci was just saying, I mean, we're going to really end up two worlds here with the highly vaccinated group having very little disease and the under-vaccinated groups having basically 95% of all the disease.
And some good news for cancer patients and their response to the vaccines?
Yeah, we've been always very concerned about immunocompromised patients, patients on steroids, patients with autoimmune disease, patients with cancer. There was a little study out of, I think, UT Texas that looked at 131 cancer patients, and it looks like 94% developed pretty good antibody to the mRNA vaccines. That was what they used in this particular study. Only 7 patients of the 131 had no antibody, so they probably have no protection at all. And those patients had myeloma, Hodgkin's disease, and they had been treated, some of them had been treated within 6 months with rituximab, one of the common monoclonal antibodies used in cancer treatment. So it's bad for those people, and maybe they need a third dose or something, or they need something else. But for 94% having a response, that's a very good report.
Interesting about these new masks that can detect COVID-19 developed or at least invented at MIT. How effective are they, or how effective do you believe that they're going to end up being?
Well, I think it's being partial to engineering. Yeah. I mean, developing a mask that actually can make the diagnosis as good as PCR. I mean, it's so clever, and this is where we're going in this country. We've got incredible engineers here making all sorts of cool products that are going to help us get through this pandemic and others. But I only know what was in the press release report, but it sounds very exciting and just another way to diagnose COVID.
All right, time for a couple questions here, starting with this. I received the Johnson & Johnson vaccine in early April. Should I consider a Pfizer booster?
Well, at this particular point, no one who's received a vaccine in the United States, it's been recommended to get a booster. It looks like it's not necessary yet. Now, that may change, so we have to stay tuned. But the vaccines appear to be working a little bit longer than originally predicted.
For someone fully vaccinated, what is the period of time in which one can expect to feel symptoms should they get infected?
This is a good practical question. It's really dependent on their exposure to COVID. So, how much they're out there, how many other people they're in contact, how much they travel to places where there's under-vaccinated populations. That's really the driver. It's not really time.
Okay, one more question here. The CDC has not given its recommendations for elementary school children yet. The teachers are vaccinated. Do you think kids will have to wear masks in schools if they can be 3 feet apart?
I think they're going to have to wear masks, and I think they're going to have to stay 3 feet apart until they get vaccinated. I mean, they're unvaccinated, and kids can get COVID, and they can get sick, and they can continue to spread this disease and these crazy variants and whatever. But the studies in children that are ongoing now should be done, I believe, by the end of this year. And then it'll open up to kids of basically all ages from 6 months up to get vaccinated. But it's very important. Now we have vaccines available for 12 and up, and then hopefully in the next couple months get down to basically all children.
Dr. Murphy, thanks so much. Hope you had a good holiday weekend. We appreciate it.
Yes, I am.
Good.
Too.
If you didn't get your question answered, Dr. Murphy answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email at globalhealthinstitute@northwestern.edu or head to our Morning News Facebook page and post one there. We will talk to Dr. Murphy again on Friday.